Okay, so it- first off, thank you for coming out and for taking the time this evening. We're probably going to be sort of 45 minutes an hour, maybe altogether. Just going through the information here. Some of it may be somewhat repetitive. If you've done the certification course online, then you're probably going to have seen some of the information in the slides in the initial presentation, which I'll try to move through sort of relatively quickly, but just in case you haven't been through that, or just to sort of go through it one more time and cover that information. I typically like to start there, and then I'll get into kind of walking through the different pieces of this standard sort of topical application protocol. And then really open up the floor for some questions and so forth after that. If you have questions, feel free to pop them into into the chat, and that will that'll be sort of the easiest way, I think, to manage the flow of the questions. And feel free to drop them in at any point, because if I see something pop up over there or whatever, just as I'm moving through, I can always kind of pull that out and take a look and see what's in there, and maybe just kind of answer on the fly as we're moving through the information. So with that being said, I think what I will do is just open up the presentation here. I'll put it on the sort of slideshow version, so it's a little bit bigger so everybody will be able to see, and we will go from there. So let me just close that and share my screen. Okay, so you should see my screen coming up here now. Okay. And so again, if you've done the sort of level 1 certification course or whatever, you've probably seen a fair bit of this information. But again, I do want to just kind of move through it quickly, cover the different points, and then again give an opportunity to make sure maybe something that we're going to go through here you're going to understand a little bit better as we talk through it or whatever, and also give an opportunity to answer or ask some questions and answer some questions about it after the fact. The reason why we're here tonight is the BioRePeel product, and our position in the marketplace, is primarily built on these sort of three pillars of the no peeling, no pain, and no downtime. There are other TCAs out there in the world. We know this. They perform. They have different, some have kind of different functions. Some are more sort of rejuvenation, skin rejuvenation, skin boosters. Others are very clinical in nature. And so, what we've done here is try to develop a product that really does both things. It can be used as that kind of skin rejuvenation, that skin booster, get the glow, the tightening of the skin, and the cleaning up and so forth, or also have clinical type of applications for the treatment of pigmentation conditions and anti-aging type of applications, lines and wrinkles and sunspotting and things like that. And so the product line was developed to kind of do both things, to take both paths. However, it was also very specifically designed, with the goal in mind to not have the downtime, to not have the excessive peeling, to not have the pain during the procedure, to kind of check the boxes on those things that are typically perceived as the drawbacks, the negatives, when you're talking to to patients about TCA peels. And so, there's a whole segment of the world that would never think to get a VI peel or something of that nature, because of those, because of the downsides of that, that are actively using BioRePeel product and have driven the success of the product in a broader sense in the marketplace, because it really kind of speaks to an audience that some of these other products just really don't speak to. The product is, the product action, the chemical injury action is based on the TCA, and then the product is suitable for all Fitzpatrick's, suitable to treat a variety of different skin conditions, can be offered all year round. And so these kind of key points, have really worked to differentiate the product from other TCA peels in the marketplace. The blue formulation is formulated for face, neck, and décolleté use. We also have the gold formulation, which we'll touch on in a minute, but the gold formulation is made more for the body and then also for the spot treatment in some of the advanced protocols. The the way that the peel is applied, this is, I mean, strictly a topical application. You're going to apply it onto the skin. You're going to use some kind of a light, massaging action to combine the ingredients of the product and spread the product onto the treatment area. There is no requirement for, 4 pounds of pressure and a certain, motions or something like this in order to work with the product as you apply it to the skin. What you really want to do is just be doing that topical application, getting a good even coating on your treatment area. And actually, the thing that we're going to touch on a little bit later, but that's even more important, is a consistent exposure time for the product, more than it is about how you massage the product into the skin and get it applied to the skin. The product is multifunctional though in that sense, and so you can be doing this together with dermal planing, hydrofacials, microdermabrasion systems, jet plasma, ProCell, like all of these different kind of mechanical injury type systems, most of which are going to be used as like kind of or let's say pre-peel, so preconditioning type of thing, but then also some of like the LED light treatments and stuff like that that can be used after the fact for the kind of more rejuvenation effect, can be used in combination together with the BioRePeel. So from that perspective, combining with these other modalities allows you to create sort of stacked treatment protocols and combination therapies that can be very lucrative from the one side, from a business perspective, and then also are going to be very strong treatment plans and treatment methodologies for your patients, and are going to drive results. The immediate results that people should be expecting is, kind of toning, tightening, firming, cleaning up of the skin more generally, exfoliation, right, and so forth. Some glow and this type of thing. But there are also the cumulative effects of multi-session series and things like this that will be working to address, like we've discussed, more pigmentation conditions, persistent lines and wrinkles and things like this, on the more kind of clinical level. The number of treatments in a series that are recommended is going to be 4 as a general matter. Certainly not more than 6. We would never say to do in a series, a consistent or a sort of a back-to-back series. And then after any series, you're always going to want to take a break. So you're going to do, your 4 sessions. Those sessions will be separated only 7 to 10 days apart for all intents and purposes. And so the 4 sessions are going to be taking place over 30 to 40 calendar days. And then after that, you're going to take for sure like a month off. After that month, you can have the client back, do a kind of a reassessment of where the skin is at, and then make a determination about how you step forward. So is it, maybe another series, or you do a couple treatments and then take a couple weeks and then check again, or maybe you're doing once a month or something. So depends on the conditions you're treating, depends on the reaction of the patient's skin to this treatment, what's happened with the pigmentation or the acne or the rosacea or whatever it was that you were working with, and then try to understand from there where do you go from there and how do you continue to maintain those results over an extended period of time. But that 7 to 10 day window is going to be basically your window for the between BioRePeel treatments in the series. The BioRePeel Gold, like we were discussing, realistically, the only difference between this product and the blue product is the percentage of TCA. Okay, otherwise, the formulations are precisely the same. Your arginine, your squalane, your vitamin B, your amino acids, all of these different things, like that's all really going to be precisely the same. And so the general effect of the product, the general results of the product, the behavior of the product is gonna be consistent from the between the 2 products. The gold is like sort of packaged and sold as a body treatment. So if you're going to do on the hands, on the arms, and the elbows, acne on the back, things like this, that's going to be your gold is going to be your go-to for those types of conditions. I have a client that was sending me that someone has like some pigmentation on the legs and things like this. So that's really where you're going to want to try to use the gold, your primary focus of gold. But from the other side, the gold is also going to be used in the melasma protocols and some of the acne clustering protocols and things like that as a spot treatment on the face. And so on the face, the neck, décolleté area. So, you would put your blue on, you would take some gold and you would spot treat, layer the gold onto those areas, that you want to treat the spots, massage it in, leave it on for the remainder of the time, and then kind of clean everything off together. But that gold is going to get that deeper penetration in those spots and is going to give that stronger action on those places where you have the particularly dark pigmentation or the deep pigmentation or clusters of acne, deeper lines, and so on. Okay. And so that's going to be the gold is going to be your go-to for spot treating like that and trying to get that next level of penetration on those areas. Both of the products, I should say, even though it kind of touched on it in the modalities piece, but both of the products, can be used together with microneedling as well. And the gold in specific, when you're doing, for lines and wrinkles or acne scarring or things like that, some of the microneedling protocols together with the blue and the gold are going to be really, really good as well for those situations. And a lot of this is covered in some of like the written protocols that we have available in the portal. And I think we have some videos on microneedling and so forth. And then even, in the Facebook group, to jump in the Facebook group and to kind of, bounce questions and ideas off of other professionals in the network that have had
You should offer.
Sorry. Oh, and so on the on the Facebook there to bounce ideas off of the other professionals that have been utilizing this product for a long time, have seen a lot of different conditions, have developed some of their own protocols and different ways to use the product kind of creatively to get different results. Those are going to be good resources to go to find more specific information on a particular approach or a particular protocol. Now, with that said, again, it's basically the same story for the gold. Topical application, light massaging of the product to combine the ingredients to spread it out over the area. So not necessarily on the face, but you're going to put it on the elbows. It's going to be going on the arms, but it's really going to be that same action in terms of the application of the product. But to the point, if you're going to use that together with other modalities, if you're going to be doing some needling or you're going to be doing something like this, you can apply those other modalities in the same sitting together with the BioRePeel. You want to stay away from heat injuries, okay? Because that can really kind of aggravate the skin. So you don't want to use laser or some of these RF, systems and things like that that will cause the skin and specifically the subdermal layers to heat up, right? Which is typically the effect you get from those types of systems. So those things you want to kind of stay away from. But anything, any of the LED stuff, the low intensity stuff, or the mechanical injury systems, you're going to be able to use in combination with the BioRePeel. You're going to want to use some discretion. I suppose you're not going to want to be doing deep microneedling, but surface 0.25, kind of exfoliation and channel opening types of needling in that. That's really going to be the sweet spot in terms of the the mixing of the modalities in those instances. The gold is a similar story in terms of multi-session series and that type of thing as well. The only thing of note here really, I think, is just the spacing, okay, of the between gold treatments, because it's stronger, because it's deeper penetration, because it's it's going to have that deeper, stronger effect. You want to have a slightly larger window in between treatments. And so when you're doing the body treatments, you're going to look for that sort of 10 to 12 days as opposed to the 7 to 10 on the gold side. The 10 days on the gold side, on the blue side, I mean, would be in reference to like certainly if you were doing a combination treatment with the gold, you put the blue, you put the gold, you want to be on more like the 10 days as opposed to the 7 days to give the skin a little bit more healing time in that instance. And so that's why on that slide when it was saying when you're using advanced protocols to be more like 10 days, that's kind of in reference to using the gold spot treatment to give yourself a little bit of a bigger window in between treatments for a little more healing time for the skin after the use of the gold in that particular case. The the sort of underlying science, okay, of this product is really what drives more than anything, its performance, the behavior of the product, the effects on the skin, the behavior of the skin after the peel, et cetera, are really all driven, again, by the underlying science here. And none of this was by accident. The product was developed by, chemists who were working in this industry, had experience with other peel products, saw the downsides of those products, and purposely set out to develop a product that addressed some specific things about the way that other TCAs that they had experience with and that they had seen were performing and behaving. Okay, and so there wasn't anything sort of accidental here in terms of what they formulated or why they did it that way. It was actually quite purposeful. And what we ended up with is this product that, because of the combination of the ingredients and the formulation, is able to, penetrate the upper layers of the skin very quickly, move down to the, past those superficial layers and start to, create that cellular turnover, the fibroblast activity, the collagen elastin production, draw out pigmentation, do all of that work, right? But from the other side, has a set of ingredients that are moisturizing and hydrating in nature and so forth, that work in concert with those, with the what we call the hydrophilic ingredients, right? That that serve to kind of protect the skin and nourish the skin and create this moisture barrier, et cetera. Also, the finishing products, the hydrating serum and the firming cream, in my opinion, and certainly in the opinion of the, the scientists, are a very important part of that same, overall approach, where you introduce TCA, you use isopropyl myristate instead of, pushing and manually trying to drive the product into the skin. We use the isopropyl myristate to accelerate the absorption of the TCA, past the superficial layers, down through the channels of the skin, to start to really, start that chemical activity, that chemical injury at the lower layers of the skin. And then using these other ingredients, both in the BioRePeel itself, as well as in the hydrating serum and the firming cream, to kind of backfill those channels in the upper layers of skin with that moisturizing, hydrating, the nutrients that are gonna help, lock in that chemical activity below, lock in some moisture and hydration in the upper layers of the skin, and keep it, keep nutrients and moisture there to prevent the peeling and the flaking and the excessive dryness and things like that. So, that mix of ingredients between the two phases, is really what balances out the behavior of the product, so that you get all of that activity and the results you're looking for, but without all of the downsides of it. The other thing that you notice there is that, the product has this, in its resting state, has this very kind of, specific, blue, blue upper layer, right? And that yellow layer underneath. And that's really caused by the separation of the two ingredients. But what the lipophilic ingredients also do is they serve as a barrier to prevent the hydrophilic ingredients from oxidizing quickly. So they retard that process. And so that also helps to keep the product shelf stable and helps to extend the shelf life of the product after the bottle's been open, right? So after you've pierced the membrane and started to take product out of there, it's still going to be good for 6 to 8 weeks sitting on the shelf, partially because of the separation of those ingredients and the protective barrier that the lipophilic ingredients cause, and how they retard the oxidation process of the hydrophilic ingredients. So, with all of that said, it's, that formulation, that science is really one of the, I think, ultimately the thing that really differentiates the product from other products. There's some other TCAs, it's, the no peel and this and that, but they've got like 3 ingredients in there and a whole bunch of homework the patient has to do in order to maintain those results. Where with the BioRePeel, you're getting your results. We don't have all the homework. You don't have the downtime, the peeling, and the rest of it. So, so formulation is really key, to kind of separating what we're doing from the others. The The next piece that I just want to touch on here is a question we're getting all the time, obviously, but contraindications. Okay, and contraindications, there's a lot of like common sense stuff here. They're pregnant, they're have open wounds, they got active infections, things like this. Obviously, you're not going to be doing peels for these people. Okay, um, retinol, retinoid actives, those are the big call outs for me. Antibiotics too, because some people are on the antibiotics and things, but those retinols, retinoid actives, those are the big call outs because those are the things that like everybody's little night cream's got some retinol in it now. Everybody's cream that they're putting on has some active vitamin C or something like this, right? So there's a lot of that in the marketplace in like commonly used products. Never mind the clinical stuff and whatever. And so it's important, that patients are aware that they must stop the use of those of the retinol and the actives and so forth about a week before a peel, and not pick it up until generally speaking about a week after. Um, Nobody's going to have a heart attack and die on you because they have a retinol cream that they use at night and then they get a BioRePeel. Okay, but but they are more than likely going to be peeling. There's going to be some like not peeling like VIP peeling with the shedding and this, but some flaking and that type of thing is typically going to be the response. And in 99.9% of cases, if you do a BioRePeel for somebody and they start with the flaking, there's some retinol cream involved, there's some actives in the stuff that they use in the morning or something, right? You told them stop a week before, they said yes, 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 of course, and really 2 days before they stopped, right? Or whatever. So it's 99.9% of the time there's going to be like you can draw a straight line between the reaction and the cause. Okay. But that being said, that's really the only real concern when it comes to this. There's not a concern that there's going to be some kind of a major adverse reaction, but there will be flaking or whatever. The thing to keep in mind is if you tell them stop using the retinol a week before, and now you're going to do a 4-session series, they're not going to be starting the retinol back until like a week after the last one because you have only like 7 days in between each of those sessions in that series. And so the idea is you stop a week before, basically once a week for the next 4 weeks, you're getting a BioRePeel. And then a week after that, you might, pick back up with the retinol or the actives products or whatever. But during that window of the session of the series, there's not really going to be an opportunity to start using those things again because you're always 7-8 days away from the next peel, or within 7 or 8 days of the last one as well. So so you just want to be cognizant of that to sort of set those expectations from the beginning that we must stop this now and we must not start it again until XYZ time. Okay. Um, the other one, I guess, is the Accutane. That's the one that's got the big waiting period on it. So if you got people that are using Accutane, you're going to want to, pull back from the Accutane. You're going to want to make sure that they haven't been using the Accutane for kind of months before they're going to get involved with the BioRePeel. Any opportunity you have to get to working with patients with acne before they're getting involved in the Accutane, that's going to be the best situation. And we've had fantastic results with BioRePeel and acne. Acne is a very complicated thing. Okay. And so I like to try to sort of temper the expectations around that. It's complicated in the way that melasma is complicated because there's a lot of, there's hormonal factors and environmental factors and what are you eating and other things. There's a lot of contributing factors there that like you have no control of, and no amount of facial TCA peels that you're going to put on somebody is going to deal with those other things, right? So there are a lot of things that contribute to acne conditions specifically, and again, expectations need to be tempered in that regard. But I've personally seen and seen countless different reports in that of incredible results with acne. So if you have an opportunity to start with the BioRePeel as a first before they go that route, that's always a good thing. And if the results are not there, the results are not there, and they're going to move on to their Accutane or whatever. But any time you can get in front of Accutane use, it's really, I think, a good thing at the end of the day for for the patient to not have to go that route. Use of product with different modalities. So like we said, the Forever Kit is going to be your go-to kind of preconditioning kit if somebody is not doing dermaplaning, microdermabrasion, microneedling, hydrofacial, something like that, some combo thing before they do the BioRePeel. Ultimately, you want to cleanse the skin, you want to degrease and whatever, you want to activate the skin and the channels, and then you want to do your peel, and then you want to finish with your hydration, your moisture, your rejuvenation stuff, right? So, you're typically going to have your kind of mechanical injury systems at the beginning. You're going to use those, to do your exfoliation, to do your cleanup and your skin prep. Then you're going to do your peel, and then you're going to finish with your finishing products. Maybe just give me 1 second because I see there's a couple things in the chat here. So yeah, you had a couple questions. So what's the percentage in each, right? So just if we take a step back, so the BioRePeel Blue is 30% TCA, and the gold is 50%. Okay, and both are modulated. So like with the arginine. So I mean, if you put a 50% TCA, never mind. I have clients that remove tattoos with 50% TCA. Okay, so a straight 50% TCA is like you're going to be on fire. But the but the 50% TCA is in the gold is the modulated, and then the 30% TCA as well in the blue. Acne scars you had asked about. So again, acne scarring, you are going to be able to to treat, and I think the protocol for that is typically going to be the blue and the gold, especially for deeper scarring, and then some microneedling protocol for that as well, to try to really get after the acne scarring. But I think offline, we might be able to reconnect about that, or I could try to find you some specific protocols about that. Okay. Um, so in any event, moving into the application protocol. So here they kind of have application protocol laid out as 7 steps. Okay. In my mind, it's 3 phases, right? It's preconditioning, it's peel application, and then it's post peel. Okay. And your preconditioning is always going to be like, a cleanse, a light exfoliation, a degreasing. Then you're going to do your peel application. You're going to wait, the prescribed period of time, let the peel sit, absorb into the skin, start to do its work and get going. And then you're going to remove that, and you're going to do your post care. You're going to apply your rehydra, your relift, your SPF, and away they go. If you're doing some after treatment, some LED therapy, some mask, a hydrating mask, or the jelly or whatever, that's going to be your post care stuff. And so again, as much as they've laid it out this way, 1, 2, 3, 4, 5, 6, 7, I'm thinking of like 3 sort of distinct classifications of activity that you're going to be doing as you do your peel application, or as you do the standard application, or even advanced application protocols. The last slide I just touch on here is just the costing piece, and it's a question I get asked all the time. Generally, right up front is how much are people paying for this, right? Because you want to kind of understand what's the business proposition here, right? So as a general matter, I tend to look at things, I tend to kind of bring it down to the lowest common denominator. Okay, and so if you buy a box of BioRePeel Blue, you're going to have 30 milliliters of product in that box. In any given treatment, for like the face, you're going to use, and certainly as I prescribe it, you're going to use about 1.5 milliliters. Okay, so like kind of a 0.5 milliliter on the forehead, another 0.5 milliliter on one side of the face, and another 0.5 milliliter on the other side of the face. Okay, so you're going to use 1.5. That means you're going to get 20 treatments out of a bottle, out of a box. Okay, even if you're being conservative and you say you're going to use 2 milliliters in a treatment, right? That's, face right down to the neckline, maybe it's going to be 2 ml. Okay, so your cost per milliliter is $16.50. Your retail per milliliter is typically going, for my clients, as I know, in every market in the country, is 125 a milliliter. Okay, so you're doing a face treatment, it's $250. If you're going to do the gold, Okay, gold, when you're working with the body, it can be a little bit different. If I'm doing like some acne on the back, well, am I doing like a little cluster of acne like this on the back, or am I doing like acne on the whole back? Right. And that, so the volume of product that you use is going to vary a lot more than the volume of product that you use on the face. Some client have a little smaller face, they have a little bigger face, whatever, but not that much variability, okay, on a facial treatment. When you get to doing the body, there could be a lot more variability. How much of the leg are you doing? Is it the whole arm? Are you going underneath or only on the top? So there's a lot more, discrepancy there from one treatment to another. And so again, typically, I'm always looking at it and telling people to price it on a per milliliter basis. Your cost is $15.25 a milliliter. You sell that for $100 a milliliter or whatever, right? And then it just becomes a matter of how much do I need to cover the surface area for this particular client. Um, okay, and so uh, when you start getting into combo therapies and things like that, now you're going to start to bury the cost differently. So, you have maybe some hard costs on your hydrofacial machine, plus the BioRePeel, et cetera. And so, maybe that's a $350 treatment or a $400, treatment or something like that when you do that combo. But from the other side, the hydrofacial BioRePeel combo is going to be very significant results, So as you start to do those combos, a lot of people are combining with dermaplaning. I see that a lot. And dermaplaning doesn't cost you a heck of a lot more than, just time, right? But also tends to give really good results and really activates the skin before you do the peel. So those types of things, again, get priced up a little bit. But that sort of 250 range for a BioRePeel face treatment is pretty standard everywhere. Now, with that being said, all right, I'm going to jump into application protocol. Okay, so bear with me for a second here. I'll just grab some of this stuff. And the standard topical application protocol, like we're saying, and this is like, whatever, 6 out of 10 people that come in, to get a treatment are going to be looking for, the BioRePeel. They're not necessarily going to want to do the combo thing or whatever, right? Like it's, if they're coming for the BioRePeel treatment, it's like they saw it online, they saw the video, their girlfriend got one, like whatever it is, and they're going to have this idea about this topical application protocol. To the point, like we've been discussing, the other side of it is that when you're doing this, you really want to make sure that you have your skin prep step, your peel, and then your post, right? And so in the absence of some other system, the dermaplaning or whatever else you might do, you're going to want to be starting with your Forever Kit, okay? Your Forever Kit is comprised of three pieces. Okay, you have you're going to have your lipogel, okay, which is the white one here. You're going to have your activator spray, and you are going to have your carbon mask. Okay, I should note, and I'm only noting it because I think probably twice today I already heard this. This spray, its purpose is to activate these products, to activate it, in one case to reanimate these products. This spray has no use for in conjunction with the BioRePeel itself. I understood from a client today that one of her estheticians, she asked me, can I buy more of this, right? And I'm like, well, why would you need more of that? Like, you want to get another kit? She's like, no, we ran out of she called it a neutralizer spray. I'm like, oh, she and so I get to uncovering that she's seen that her esthetician is spraying this onto the BioRePeel and then cleaning it off and using it as like a neutralizer. So I guess she misunderstood, okay? But the point is that it's not a neutralizer, it's an activator spray for this stuff, and shouldn't be used with the BioRePeel, because like the spray should last as long as these bottles. And if it's not, there's some reason for it. And I'm just like, I hadn't heard that before. I couldn't understand why this would run out. And then she's explaining to me that the girl's using it as a neutralizer on the BioRePeel. So we don't do that. But in any case, first thing out of the gate, patient comes in, they're going to sit down in the chair. The first thing you want to do is you want to be going to the lipogel. The lipogel is going to be, it's kind of going to act as like a gentle, like a kind of a cleanser, but also as a gentle exfoliant. Okay. And it has the silica beads inside, the small, like the micro silica beads. And that's going to help to exfoliate off dead skin off the face, off the treatment area. And also give a bit of a cleansing. I always shake them up first, okay, and particularly this one, but just in general, I like to shake them up. I always shake them up a little bit first to make sure that they're kind of constituted nicely and that the silica bead spreads out, because as they sit, they'll tend to settle a little bit. So you want to shake it up. You want to put some on the hand, and like if I just bring my little model over here, you want to put some on the hand, and then you just want to apply it on the skin, okay? And as you're doing so, like whatever, you're gonna put some on the hand, you're gonna put some here, put a little bit more, you're gonna get it on the one side of the face, a little bit more on the other side of the face. But this first pass with this product is not going to be like, you're not going to be putting it on and working it in and doing that. Just apply it to the skin, okay? A good, even application so that it's on the skin. You're going to take the activator spray. You're going to spray that on the area that you applied the lipogel. And then you're going to start now with your more purposeful working in of that product. And with the activation spray, it should start to, like, as you're working it, as you're kind of cleaning in the, the nasolabial folds and the side of the nose and on the chin and so forth, and you're working it around the face, and it's interacting with the skin and the oils and whatever else. It should start to foam up a little bit, and so you'll see it kind of white and foamy under the hands, and you'll feel the silica beads under your fingers as you're kind of working it around and get that exfoliating action. And so you'll want to, give really a good sort of a cleanse, a good working to all of the area that you're going to work with. Once you've kind of done that, you're just going to clean this off with a damp sponge, a damp gauze, and then towel dry that area. Okay, and so there's no like neutralizing, or there's no something special like that. Just with water on a damp sponge to kind of clean up the area, and then just to towel dry with a dry towel. The next, you're going to go to the mask. And so with the mask, same story. I like to just shake it up, make sure it's kind of mixed and constituted nicely. And then same thing, onto the hands, apply it to the skin. A little more, apply it to the skin. I know some of my clients, they have like the little brushes or whatever, so they'll lay some down and then use the brush to kind of spread it out evenly. But that's ultimately the point, is that you want to just be spreading the product out evenly, a nice, even, consistent layer of product onto the face. It's not going to be like a thick black, tarry kind of you're not going to be peeling this mask off. Okay. Ultimately, it's going to go on. It's going to be dark on the skin. It's going to be obvious, that it's there where you've put it. Okay. But not going to be anything thick or heavy in that sense. Just a nice sort of even coating applied to the skin. This one, you're going to now leave for 5 minutes. Okay. So maybe you're going to start a timer, 5 minutes. And during that time, it's going to go on wet, but in the 5 minutes, it's going to dry and it's going to kind of set on the face. After the 5 minutes is up, you're going to take the activator spray. You're going to spray now on all of that area that you put the mask, and it's effectively going to reanimate it. Okay, so it's going to go now from dry to be again kind of wet, and in that wet state, you're going to be able to peel little thin layers of this off. You could do it with the fingers. Sometimes they say, "Oh, just wipe it off." For me, I get there. I do the kind of peeling action with the fingers, right, and peel the stuff off. Get as much of it off with the fingers as you can. You kind of get into the sides of the nose and the in the creases and the small areas. Really try to get as much of it off that way as you can. Peel off those strips, and then take some damp gauze, some damp sponge, wipe up the area. Make sure there's not any residues or whatever left behind, and then towel dry that area. Okay. So once you've done the cleanup here, okay, and you've towel dried, now you're going to be moving on to the peel, to the main actually the application of the BioRePeel. I should note that the amount of time that you're going to be spending with the preconditioning, it's probably going to be like 12 minutes. Okay, from like the lipogel, you put it on, Then you're going to work it for a minute or so, a minute, something like that, about a minute. You're going to clean it up. You're going to apply the mask. It's going to sit for 5 minutes. You're going to clean it up. By the time you're done with all of that, you've towel dried the face after the mask. You're probably going to be like 12 minutes has gone by. Okay. Now you're going to go to the peel, the BioRePeel. So again, when you first get a bottle, out of the box, it's going to be this blue and the yellow. It's going to have this little tab in the top. Okay. It's going to be like totally sealed. You can just kind of get a fingernail, or a tweezers or something underneath this little tab, and you're going to be able to peel it back and take it off. Okay. And when you do, it's going to like expose the kind of, this membrane, this foamy membrane that's underneath here. Okay. And now this one, like I've opened this bottle before, I've pierced this membrane before, but it's not like, it's kind of like one way, right? So nothing's going to come out of here, after it's open. Um, you can't really, spill the product out or anything like that. But in any case, you'll see here this gray membrane, and that's what you're going to be piercing with your with your syringe. You'll also notice that, again, the product in its kind of resting state is going to be that blue and yellow state. That's not how you want to be using it. So when it comes time for the peel, now you're going to take your bottle. Give me 1 second. I'm just going to grab a syringe here real quick. You're going to take your bottle, and then you're going to shake it up. Okay, and so you're going to shake it, sort of 4 or 5 seconds, okay, just to kind of get it constituted nicely. And you're going to see now that it's going to be this like thicker green color, okay? And that thick green is what you want, is what you want the product to be looking like when you, when you're ready to use it. I always, and as a rule, I'm going to want to aspirate the bottle before you go in to draw product out. Okay. So, and especially when you take a new one that's like just a fresh bottle that's been, shipped to you, you haven't used it yet. There could be air built up in there from, how it was bouncing around in the shipping or whatever. And then you're going to shake it up. Okay. So there's a good likelihood that there's going to be some air buildup in there. And when if you just take the top of the, cannula, pop it in there real quick, a lot of time you'll hear it like a little puff of air that's going to come out of there, and so you'll aspirate the bottle in that way, so that air gets released out of there, and just put it in for a second, and you'll hear that little burst of air, and that'll be enough. Then I'm going to attach the cannula tip to the syringe, maybe just a little bit the light shake one more time, and going to go in there now to draw out the product, and it should draw out kind of real nice here. I've aspirated the bottle well. I don't have a lot of air coming out in here. Okay. And I'm going to pull out, 1.5, right, on my, in my syringe. Okay. And I always, again, I'm telling people, like, start with the 1.5, because for me, I've found that 1.5 is enough to do a really good, even coating on the face. You can kind of get, right down to the jawline, and it's going to be more than sufficient for really any size of the face. Okay, but the other thing is that you take out the 1.5, you lay it down, and you know what? You need a little bit more to finish up over here. Go take a little bit more. I'm not about putting product back in the bottle. I don't like this. You're introducing air into the bottle, and so forth. You've taken it out already. Like, I'm not about, putting product back if you can avoid it. So you pull your 1.5, you use that. If you need to go back for a little more, you can always go back for more. But I've found that 1.5 is a good volume. Okay. Let me just grab a glove over here. Okay, so then when I put this on, so now you've got your 1.5, and you're going to start to apply the product. And if you guys, you've all seen the videos, you've all seen the pictures, and they do, these little dots, right? They put the dots down real nice, and it looks super cool in the picture. They say, ooh, that looks real nice. But really, it's kind of an aesthetic thing at the end of the day. Okay, there's not a science per se, okay, to doing these dots, right? The purpose of putting down the dots is really just to kind of control the volume of product that you're laying down, and not have a situation like where you put a whole bunch on and it's like running down the side of the face or it's dripping down or whatever, right? So it's really just about controlling the volume of product that you're putting down. You could lay down little strips over here and do the same thing, right? For me, the goal is, kind of pick a side, and again, I always look at the face as like kind of three quadrants. It's a quadrant's like four, but in any case, three areas, right? So there's, the forehead kind of from temple to temple, the one half of the face symmetrically, and then the other half of the face symmetrically. Okay. And so if you do a kind of a half a mil up here, a half a mil over here, and a half a mil over here, that's going to be your 1.5. And it's also going to be easy to kind of control and manage in here because you're going to pull a milliliter and a half. You're going to lay some down. You're going to massage it in. You're going to lay a little more down. You're going to massage it in. You're going to see that you're, at 1 mil. Put the syringe down, and kind of finish massaging in this area. And what you're going to be doing here, so now you've laid down your forehead area, you're going to be massaging all of this product in, and you're just going to kind of keep lightly massaging it and working it until you start to feel that it's getting sticky underneath your fingers, right? Like that it's this tackiness on the gloves, and the gloves are going to be sort of sticking to the head. That's when you're going to start your timer. Okay, that's when the product is combined and activated, and yeah, it's really sticky. Combined and activated and working. Okay, and so once you get that tackiness, start your 7-minute timer. Okay, now you're gonna, okay, Miss Patient, turn your face, and then you're gonna start now to put down on the side of the next side of the face, right? So kind of from the temple, down around that half of the face. Um, a couple things of note, and it's a question I get all the time about proximity to the eyes or like eyelids and things like that, under eye, right? You don't ever want to lay product down beyond the orbital bone, but you can like lay some down here and then with the finger, kind of come up, a little closer to the eye, come into the area over here, right? You don't want product getting into the eyes or running down or dripping in. So you must be very careful. But at the same time, if you're just using with the finger, and just getting here, just coming, above on the eyelid, it's okay. And you just don't want to lay product down beyond the orbital bone, okay, when you're dealing on the side of the face. Another important note. So the top is sticky. I start my 7 minutes. Now I start working on this side of the face, okay? When I finish this side of the face, I want to be cognizant of how much time has passed, okay? Maybe it's been a minute and a half, all right? And then we're going to turn and we're going to start to do this side, and we're going to finish massaging, and it's going to be tacky and it's going to be sticky. And then I'm going to look and I'm going to see that another minute and a half passed. Okay, so now it's going to be, 4 minutes until the alarm goes off, and I'm going to start the cleanup on the forehead where I started. When the buzzer goes off and I start my cleanup, the product is going to come off faster than it went on. Okay, because you're going to be massaging for, sort of 45 seconds or a minute, maybe even, right before it really starts to get sticky and you move on to the next area. And then when you apply the product over here and you do the same thing, it's going to be about a minute and a half or so before this side is at that tackiness, that stickiness level that you want before you move on to the next level. And so when I clean this off, if it only takes me 30, 45 seconds to clean up the forehead, right? And again, it's just going to be a damp gauze, a damp sponge, just something, lightly wet, not wet that it's going to be water running down the face and whatever, but just damp, okay, so that you can clean it off. Maybe that cleanup is going to take 30 seconds. Well, that means that I want to wait at least a minute before I start cleaning off the side of the face. Why do I want to wait that time? Because I want that the exposure time on each area of the face is the same. If I wipe this up and then I immediately go to wipe this up, it means that this part of the face got 1 minute less exposure time than this part did. And then that's going to clean up real quick. And then I'm going to do this. And this side of the face got like 2 minutes less exposure time than the forehead did. So it starts with being cognizant of the time that it took you to apply the second area. When I finish applying the second area, I take a look at the clock. I see I'm at, whatever, 5.5 minutes left, right? And then when I finish over here, I see I'm at 4 minutes left. Okay. And then I know that when I clean up the forehead now, and I look and I see, because for me, I start a second 7-minute timer, like just to understand the time, right? And I see that it took me 30 seconds to clean up the forehead. I know that I'm going to wait now, okay, for like a minute or so before I'm going to start here. And then after I clean up here, I see that it took me, only another 30 seconds. I'm going to wait now a minute and a half before I start cleaning up this side as well, so that we get that consistent exposure time. Because the last thing you want is that you have, 7 minutes up here, 5 minutes over here, and 3 minutes over here. It's going to be totally different exposure time all around the face. The other thing that you must never do, that I've seen people do, is they put dots everywhere. Everywhere they're putting dots. And then they go and they start massaging the product. And no word of a lie, I had a client that sent me a picture of somebody and they had, white dots on the forehead, right? Oh, why did that happen? Why did that happen? Because you put dots of the product on the forehead and then you put dots all over the rest of the face and then you started massaging. So those dots that were sitting on the forehead were sitting there for like 2 minutes before even you started to, before you finished doing the rest of the face and started working with that. So it was that kind of overexposure or that different exposure time. It goes away quickly, right? But the point is that the immediate after effect of that was a kind of visible, dots that were left on the forehead because they had been exposed longer than the rest of the face. So definitely don't do the whole face and then go and massage it in. Always work in the sections like we're discussing, and always be cognizant of that consistent exposure time around the face. Um, After the product sat for the 7 minutes, after you cleaned everything off with the damp sponge, the damp gauze, you're gonna again towel dry the area, make sure it's nice and dry, nice and clean. You didn't leave any, any green stuff behind, underneath, or whatever. Okay, and make sure it's cleaned up real good. And then you're going to be finishing with your hydrating serum and your firming cream. Okay. Um, I don't know. Some people, you got like the smaller versions like this, right? And that starter kit. Other ones, maybe you have like the back bar size like these. Okay, but I mean, they're the same product. The principle is the same. You're going to do one pump of the Rehydra should generally be enough, to put on the face, on the whole area that you treated on the face. So you're going to put, a pump of that, kind of get it on your hands, spread it onto the area that you were working, and just, massage that all in until it's really absorbed all the way. And then one pump of the Relift, same story, pump on the hand. This one's a lot thicker. It's got some, butters in it and whatnot, right? So it's more of a cream. Going to get it on the hands, going to put it on the face, and massage all of that in and make sure that it's really kind of worked in and absorbed. After that, some mineral-based SPF, something like that, to apply to the skin, and that's it. And then the patient should be ready to go. As far as timing, again, from where is it? From the lipogel to the relift, 30 minutes maximum. There's no reason it should take longer. You're going to be 12 minutes here. You're going to be you're going to be 2 minutes, okay, on your initial application of the BioRePeel as you get started onto the forehead. I bet you're going to be a minute and a half, whatever you're going to be. You're going to start a 7-minute timer. The cleanup is going to be another minute or two. The application of these guys is going to be another minute or two. I can't think of a time when I ever did a peel that a session like this, a standard protocol, topical application that extended beyond 25 minutes, never mind 30. Okay, so 30 minutes is like maximum time that I can think of that this protocol is going to take. And so again, if you're thinking about kind of cost, versus what you're charging for the service, you have your hard cost of materials, right, of your peel and your pre and your post and whatever, and then your 30 minutes of time, right, is really effectively what you're looking at here. Once you're done that, again, there isn't a like a post peel at home regimen that must be followed or something like this, right? The expectation is that the patient's going to go from there. Maybe over the next couple of days, they're going to have some dryness, some tightness in the skin, okay, which is, I mean, it's normal and it's expected. Hydrate, hydrate, hydrate. That's like the golden rule, dryness, tightness, 2-3 times a day, hydrating. If they're going outside, they should be wearing SPF for sure. Mineral-based stuff. Makeup should be mineral-based stuff. They should try to stay away from anything, not mineral-based like that. Try to stay away from, creams or things that moisturizing type creams or whatever that may, clog the pores or something. No actives, no retinol, but not, it's more of a list of like don'ts than it is do's, right? In some cases, you have these products as do. You must do this, you must use this cream, it must be every 2 hours, it must be blah, blah. Hydrate is necessary, SPF, that's really going to be it, okay, as far as home care goes. These formats of these products were developed specifically for the purpose of sending people home with the same product that you finished them with, right? And it's not because this hydrating serum is the best hydrating serum in the whole world, right? And I think probably a lot of us have had this discussion, but it's not because it's the best hydrating serum in the world. Maybe it is. It's because it's the hydrating serum that was made to work together with BioRePeel without contraindication, with a specific set of ingredients that addresses a specific set of possible after effects of the peel, right? That provides a specific type of hydration to the skin because of what's going to be taken away from the upper layers of the skin, from the epidermis, by the chemical activity of the peel, right? So again, it's a science thing, right? And so basically you want to be using this, these hydrating serum, the firming cream, you want them to be using them at home if you can. It's going to save you the trouble of guessing what they're putting on their face, and is going to save them the trouble of having some kind of, a negative after effect because they got the CVS cream from the thing, and they put that on top of this work that you've just done. Um, and Leah, you've made a good, you have a good point here. So advise clients not to use thicker cream post treatment, and yes, you do want to advise them really like to try to stay away from it at least for a few days, right? Like as the skin is healing and it's going through that initial process. Also, something to note is that for acne prone patients, as an aftercare type of thing, uh, not even to use the relift, just stick with the Rehydra because the Relift's got the butters in it and stuff that can tend to clog pores and so forth. And so for people who have, are kind of acne prone or acneic at that time or whatever, better thing, just stick with the Rehydra as far as aftercare goes, right? Just to keep the skin hydrated, provide the nutrients. You don't, but not necessarily to get into the heavier cream. Okay, and now just some other questions here. So, Esma, you're asking with the peel, the timer starts once it's tacky, correct? And the answer is yes. Once that first area, okay, as you're laying it down, you get that stickiness, that tackiness. That's when you want to start your initial your initial 7-minute timer. Okay, and then from there, like we're saying, you're going to be working on that same timeline around the rest of the treatment area. Um, how will it help with pigmentation without brightening home care treatment? Listen, that's kind of the magic, right? Or that's one of the differentiators because there's going to be this chemical activity, there's going to be this cellular turnover and this activity that's going to be taking place, over the time, over the course of the few hours pursuant or even the days or so pursuant and so forth. But I don't know how to answer how does it help with pigmentation without the brightening home care treatment. I know that it does help with pigmentation without the brightening home care treatment. And so, I mean, I'd have to get like Dr. Agnes or or Carlo or somebody to do like a skin science seminar, to probably really delve into that question. I know what I don't know, and I don't know the answer to how it does it. I just know that it does do it. Right. Um, how much for an add-on treatment if we are doing with microneedling, or do we charge the full price for both? So that that too, like I know that a lot of people like well, so I should say like that. I know of some of my clients that are getting into like the $350 and $400 range for microneedling with BioRePeel. And I know that in some cases, people are upcharging dermal planing and things like this. And then I know that there's other cases where they don't upcharge it like that. And like instead of doing the preconditioning, they're doing a dermal planing, or they're doing a light needling, and then they're doing the peel, right? And like with microneedling, you've got your tips, and there's some hard cost in that and whatever, right? And there's the time that it takes to do it and so forth. But again, so how people charge, how people build combo treatment pricing into their menu sort of varies from place to place and market to market. And it also varies depending on how much you charge for that treatment as a standalone, right? So, if a microneedling session is, $150 or $200, and then and a BioRePeel session is 250, combining them together, maybe you make it 300 as opposed to the 4 or 5 that it should cost, or whatever, right? So, that I think in a lot of instances is going to be, kind of using your discretion to understand what your market will bear, right? But also looking at it from the perspective, again, for me, always of, hard cost and time cost, right? And just doing something that makes sense. Particularly, like I say, for the maybe not so much for microneedling necessarily, but particularly for like the dermal planing sessions or things like that, that will replace some other time and hard cost on the preconditioning side. Those are going to be easier to quantify, right? And figure out how to price than maybe microneedling will be, because microneedling, you're going to have, again, a hard cost on top of the time cost. um, that's going to be a factor. If you microneedle right on the product, you're going to mitigate some of that additional time cost, which is also a possibility. You can lay the BioRePeel down, and while it's still wet, microneedle right over that product. Okay, and actually, if you watch the microneedling video, that's the protocol that Mandy uses. She puts the product on. She doesn't massage it in until it's tacky. She lays the product all out on the face, and like while it's still wet, she goes and gets the pen and starts needling on the areas of the face. And then after she's done with that, then she just does a little bit more, a little bit more of a massage of a wipe until it gets the stickiness, and then she leaves it. And so that protocol help you to mitigate the additional time, within that procedure a little bit, even though you do still have some hard cost on the equipment. So, and I will say that this is a good type of a question to put out there, into Facebook world. You're going to get 2 dozen answers back about, I charge this, or we do like that, or we build it in here, or we stack it like this, and you're going to get some good feedback from people who have built that into their menu specifically and found ways to figure out how to monetize it and how to kind of sell it. So definitely a good question to ask to the Facebook community as well, to get some more kind of a specific feedback, and potentially even from the same market you're in, right? To help what's going to be an appropriate price point. Um, Benzoyl peroxide for face and pre-wash. You know what? I am going to ask that question right now on, bear with me for 1 second here. I'm going to ask this question right now on my chat group here, and I'm going to see if I can get an answer for you specifically about that right now. Let's see here. WhatsApp. Go on to WhatsApp and ask them about BP. Where are we? Here we are. Okay, in the meantime, while they're answering that, where can you find the video of the microneedling protocol? So let me share my screen here real quick. And we are going to go to, I think, let me find the screen where it is. Okay, here we go. I will show you where, and I'll send you a link to it after that. But in any case, let me just share my screen real quick. So we have our YouTube page, okay, the Bioskin Aesthetics YouTube page, and on the Bioskin Aesthetics YouTube page, we've got like full application video, dermal planing. We've got some different presentations here, which are also very helpful. And we have the face treatment, and here we have advanced protocol. Okay, and this video is the microneedling protocol video. We also have in the protocols in here, okay, inside of your like client portal and that training area, We have also protocol documents, and you're going to have BioRePeel with microneedling. Okay, and there's like a step-by-step here as well. So you'll be able to find that the written one here, and then the video is here. And like I say, I'll actually I can probably just do this. Let me grab this right now, and I'm going to pop it in the chat over here. Okay, and okay, I just popped that YouTube link in the chat, so that's where you're going to have your the microneedling protocol video. Okay. And the other thing while we're on this, in any case, is just inside the client portal here. Again, I mean, you're going to have lots of stuff. You get the pre and post treatment stuff, contraindications, doc, jet plasma protocols, different bunch of different BioRePeel, standard protocol stuff, melasma, microneedling, acne, etc. You got some protocols here for the mesotherapy stuff, which is a whole different conversation in the session. Ingredients lists, patient consent form, and then you've got like some marketing stuff, brochures, images, and when you go in here, I mean, there's just like a couple dozen images in there. You got some more marketing stuff in here, so there's lots of kind of collateral that you can use in here as well, for some of your own marketing stuff or whatever. The other thing is anything that's on the Facebook page, anything that's on the Instagram page or anything like that, that's all kind of public use stuff, okay, that you should be able to get into and use, okay. Let's see here. Benzoyl peroxide. So I'm getting no and no way. Okay, so I guess it's a no for the benzoyl peroxide face wash, pre and post. Okay, seems to be the answer I'm getting.
Thanks.
Yep. Yeah, no problem. Okay, so yeah, I mean, other than that, to the point, if people have any, yeah, I got another no, I won't, she says. Okay. If anybody has any other questions, by all means, don't hesitate to reach out. You know where to reach me. I think ultimately at the end of the day, I tell people all the time that my job is not, sales guy, right? My job begins after you come on board and you're working with us and you need, a channel to get service, support, to order, to work with us. Like, that's really what I'm here for. And so definitely, any assistance you need, any additional questions you have, feel free to reach out, and I'm always going to try to, get this information for you, and kind of be as responsive as I can. And ultimately, your success is my success in this regard. So, for me, it's important that you know what you're doing, you feel confident about it, you know the answers to your questions, and you're able to, kind of go out and work with the product and sell it and whatever. So, definitely don't, like I say, don't hesitate to be in touch if you need anything at all. And look forward to continuing to work with you. Thank you very much. Have a good night.
Thank you. Good night.
Thanks.